Good morning, all. Myself Prashant K, Professor and HOD, Department of Child Health Nursing, Al Shifa College of Nursing. So, today we are going to see one of the very important topic, that is weaning. Before going to the topic, let's recall what is breastfeeding, what is exclusive breastfeeding. So, once we talk about exclusive breastfeeding, it is nothing but the baby should be fed only breast milk till 6 months of age, and no other foods other than breast milk should be fed to the baby during this 6 months of age, because the breast milk alone is more than enough to meet all the nutritional needs of the baby during that particular period. But once the baby reaches to the age of 6 months and beyond and go beyond, breast milk itself alone is may not be sufficient to meet the nutritional needs of the baby. That time we should think about some additional diet along with the breast milk, and that is what is exactly called weaning. So weaning doesn't mean there is a complete stoppage of breastfeeding. Rather, we are transferring. It's a progressive transfer from the breast milk to the normal adult diet, and in this class we are going to see more about weaning. Let's see the definition. It is the process of gradual and progressive transfer of the baby from the breastfeeding to the usual family diet. This is exactly what we are saying so far. It is the process. It's not not happening in a sudden onset. It's a gradual thing. It's a gradual process where we are progressively transfer the baby's diet from the breast milk alone to the family diet. Why it is important? Let's see what are the aims of weaning. Once the baby reaches to 6 months old, there is a rapid growth and development what we can observe in the baby's milestone. So this shows the baby needs more nutrients. So breast milk alone may not be sufficient to meet that requirement. So we are thinking about some additional food that has to be introduced along with the breast milk, and that is called weaning. So far the baby's gastrointestinal tract may not be familiarized the solid diet, because till 6 months of age only the breastfeeding is happening to the baby. So once we start the baby, we are training the gastrointestinal tract to digest starch and other solid foods also, and we are educating the child independency by using spoon and cup. Let's see the principles of weaning. A good quality food items, and it should be homemade. Gradually, as the appetite level of the baby increases, we are increasing the quantity, we are increasing the amount of food also, and introduce new foods once at a time. So the baby may be given food as the rest of the family takes, and we should always encourage our children to take their food by themselves. Thereby we are reducing the dependency of the baby. Mother and child are taught about the hygienic habit. This is actually very important. There should be some sort of chances of food infections can be happen, because of once we compromise the hygiene pattern of the baby during weaning process, and they'll be very risky, and mother and children are taught very much about the importance of hygienic practices that should be stick on during the weaning process. And breastfeeding that can be continued till the age of 2 years or beyond. That's according to the choice of the mother. No strict rules should be enforced, and food should be given when the infant is hungry, and never ever force the baby to take the food. observe for any indigestion, pain in the abdomen, diarrhea, rash, and if these signs are evident, it should be immediately reported to the pediatrician, because these are the signs that can be evident during this time of infections. And if the child is having any indigestion, food poisoning and all, these signs can be evident. And once we observe any sorts of sign like this, it should be immediately reported to the pediatrician. Now we are going to see what are the stages to introduce the weaning. The stages can be clusterized fundamentally into 3 according to the age ranges of the baby, month ranges of the baby. And these 3 stages can be clusterized into stage 1, stage 2, stage 3. That is stage 1 to 3. So stage 1, the consistency of the food, that should be very cautious about. The consistency of the food should be made into a very puree, very smashed forms, because so far the baby was very familiarized, very habitual of taking the foods in a very liquid form. Okay, so this is the first time we are introducing some sort of solid diet, so there is a chance for the baby, there is a difficulty of the baby for swallowing the food. So the food should be, the consistency should be made in a very pureed form, so that the baby can easily swallow the food without any difficulty, and it will help for the digestion, easy digestion also. Second stage, once the baby learn to accept the smooth foods, we are ready to move on to the mashed foods with soft lumps and offer some fingers foods with all meals. Finally, once the baby reaches to the age of 9 months, stage 3 begins. Now the baby is ready, as like we do the family diet, 3 meals per day. Okay, so the food items can be made into minced and chopped, so that we can the baby can take the foods by himself, and along with that we can promote the self-feeding of the baby also. Choose a quiet time of a day, halfway through a feed. Smooth, mash or puree form foods that we can introduce in the stage 1 of